And our next story is about China's mysterious virus outbreak. A virus called the human meta-pneumo-virus, or HMPV, is spreading in China. Its flu-like symptoms are similar to COVID-19. On Friday, we asked, why is China silent on the outbreak? And tonight we are asking, is China hiding something about the virus outbreak? You see, China is dealing with an outbreak of the human meta-pneumo-virus 5 years after the COVID-19 pandemic. Reports and social media posts, in fact, suggesting that the virus is spreading rapidly. You might have come across videos shared online claiming to show scenes similar to the COVID-19 outbreak 5 years ago. Of course, we all remember how that turned out. It turned into a global pandemic and led to over 7 million deaths globally. Now, some Chinese social media users are saying that multiple viruses, including influenza A, HMPV and COVID-19, are circulating. And what is China saying? Not much. China calls the HMPV outbreak winter occurrence. Beijing issued a press statement to address such concerns. On Friday, China's Foreign Ministry spokesperson Mao Ning said that respiratory infections tend to peak during the winter season, but that has done nothing to allay fears. China's neighboring countries are on high alert. In India alone, 3 new cases of HMPV have been reported on Monday. In Bengaluru, a 3-month-old baby who has been discharged and an 8-month-old who is recovering at a hospital in Ahmedabad, Gujarat. A 2-month-old boy was reportedly detected with HMPV. But authorities are urging people to not panic. You see, HMPV is not new. It has been around for decades. According to India's top medical body, ICMR, HMPV is already in circulation in the world, including in India. The Indian Council of Medical Research has assured that India is well equipped to handle any potential increase in respiratory illnesses. Indian authorities are, in fact, urging people to not panic. On Monday, the Karnataka government assured that there was no cause for alarm. They said that HMPV is already present in the country. Karnataka State Health Minister has said, and I'm quoting here, "I don't think we should be pressing the panic button because HMPV is not a new virus. It already exists. Reports suggest that it is the first case of HMPV in India. It's not true because HMPV is an existing virus and a certain percentage of people do get affected by this virus and it's not something new," quote unquote. But here's why people are terrified of China's virus outbreak, and it's being talked about. Number one, there are no specific antiviral therapy or vaccine to prevent HMPV. Number two, China's Center for Disease Control has warned people to take precautions with health and hygiene and also pushed back against online claims of overwhelmed hospitals and fears of another COVID-like pandemic. COVID-19 also broke out in China under innocuous circumstances. Remember, the world is still reeling from that decision that Beijing took. Naturally, questions are bound to rise. The symptoms of HMPV are similar to a cold or flu. It's one of the several viruses often lumped under a broad definition of the common cold. But it's not a notifiable disease like COVID-19 or influenza. They are not notifiable because they are very common and lots of people get them. You fall sick for a few days, but with rest, you get better. And who is most at risk, you ask? HMPV can lead to more serious illnesses like bronchitis, pneumonia, especially among elderly people, very young children, and people who are immunocompromised. And that is exactly why it's important that people know it's out there. Sure, HMPV is not like COVID-19. It has been around for several decades, and there is a level of immunity in the global population from past infections. So what does one do about it? Practice good hygiene. Experts have urged people not to go to work while sick. Wear a mask if you do have to go into the community. Wash your hands with soap and water for at least 20 seconds. These are small habits that can go a long way and prevent the spread of infections, especially for those at higher risk. Unlike COVID-19, which was a new disease which had never infected human beings before, HMPV has been around for decades. But that's not why there is concern, is it? It's the surge in cases reportedly and the impact it's having that need to be taken into account. A good lesson from the COVID-19 pandemic would be to reduce the spread, especially as we don't have vaccines or antivirals for HMPV. We can educate ourselves, take precautions. Also, there is need for absolute transparency, which is no longer an option. It is a necessity. In fact, earlier in the day, we reached out to the World Health Organization, WHO, on China's outbreak. Here's the response we got, quoting from it. The Chinese Center for Disease Control and Prevention publishes weekly reports on its monitoring of influenza-like illnesses. The latest from 2nd January is here, and there is a report, a link basically. It reports that, as expected for this time of year, the Northern Hemisphere winter, there is a month-over-month increase of acute respiratory infections, including seasonal influenza, RSV, and human meta-pneumo-virus, HMPV. The reported year-over-year level of influenza activity is lower, meaning it is less than the same period last year. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.